Hi, I'm Geert van Manen, Health Minister of the Netherlands. This winter we had a particularly difficult flu season. While our response was very effective, it was also very costly. Today I have a meeting to request an injection of additional funds. These conversations can be difficult, but healthcare is an essential government function, so I'm confident that our request will be approved. Good morning, Minister. You have a lovely tie. Thank you, Minister. And good morning to you too. I'm Finance Minister van Manen. So tell me, what can I do for you today, Minister? More money. It's always more money. I'm sure you're aware of this year's unprecedented flu epidemic. Yes, of course. Unfortunately, the demand for services required spending beyond our budget. Here it comes. So thanks to that nasty flu, we need some additional funding. It's the same every year. Yes, but this was a very aggressive strain, which couldn't be prevented by our normal vaccination program. I don't mean the flu, I mean the overspending. Oh, right. This year it's the flu, last year it was the hepatitis C medication, next year it will be something else. But Minister, we had no alternative. We had a quick response, which led to no increase in waiting times, nor in winter mortality. I appreciate your efforts, but health spending is becoming unsustainable. You are asking extra money on an annual budget which is already growing faster than all other budgets in the public sector. Is he serious? We are saving people's lives and we are making society healthy and productive. And he's worried about a little extra money? It is very difficult to predict the needs for a certain year. First reason is an aging population, and the second is there is a growing demand because of new technologies and new medicines coming into the market. Excuses, always excuses, and never coming with solutions. Yes, I understand that you have your reasons, but if you ask me, I didn't. The salaries you pay your doctors are too high. They are twice as what is paid to other workers in the public sector. But pay increases are below inflation already for 6 years. And we have a staff turnover which is increasing. Cue the do more with less efficiency speech. It's not just salaries. There's so much waste in your system. You could do fine with your budget if you really would make steps to achieve more efficiency gains. I told you so. Tell me, what actions are you taking to improve efficiency? Minister, we would love to make some structural changes into the system. We would like to strengthen primary care and we would like to spend more on prevention and public health. But the limited resources we have, we cannot do more than for the day-to-day needs. I believe you. You look like an honest man. In fact, I'd be happy to give you some additional funds. But your budget is a black hole. You spend and spend and spend. Where can you give me some return on investment? We do a lot to make spending more cost-effective. We calculate return on investment and we make use of the health technology assessment to ensure more value for money. I'm not naive. Most health spending is not very well evaluated. But even low-cost initiatives become very expensive, especially when they are used very quickly by the entire population. And just who should we turn away? Imagine if children didn't receive their vaccination or their medicine. With all due respect, Minister, you cannot put a price on health. I must put a price on health, not for individuals, but on the system as a whole. It's my job. Did he really try a think of the children line on me? More health spending for children means less spending on schools for children. And the educational budget gives significant and clear contributions to our economy. But Minister, there's a lot of evidence demonstrating that health makes a contribution to the economy. A strong economy needs also a very healthy Workforce, isn't that right? I'll tell you what, you look like a smart guy. I'll consider your request, but I'll ask you to come back to me next week and show me how your actions can fit into my budget priorities. And then I hope we can have a fruitful discussion together. Okay, I can do that. Thank you, sir. That didn't go as I expected, but I sense that the Minister of Finance and I have a lot in common. I do see value coming out of the health system, but I can't give money to everybody who comes through my door. But sometimes it feels that we speak different languages. I need better evidence that this money is well spent, and granting the request makes economic and fiscal sense. If I want him to approve my funding request, I'm going to have to show him that the budget is well spent and gives value for money. But how?